Applying medical anthropology to my chemistry major. My goal is to earn a Bachelor of Science in Chemistry. This is my way of differentiating myself from my peers while preparing myself for rigorous course loads and expectations in medical school. I'm a people person who enjoys helping others, so becoming a doctor is my way of having hands-on interactions with people on a daily basis and help them make life-changing decisions that will have immediate consequences. So why a degree in chemistry versus a degree in biology for a future in the field of medicine? Well, the chemicals in the body are responsible for all bodily functions. I intend on specializing in a field of medicine known as anesthesiology, which chemistry plays a vital role. Anesthesiology is all about balancing chemicals in the body to keep the patient unconscious and alive. I feel that by starting my chemical education now, this allows me to be better qualified to treat future patients. Combining a medical anthropology minor with my major in chemistry will benefit my patients by allowing me to explain an illness while being consciously aware of their cultural beliefs for the illness, and will allow me to explain proposed treatments, once again being consciously aware of their cultural beliefs for the proper cultural treatments. For my future profession, having a background in medical anthropology versus not having it comes down to one important difference: treatment or no treatment. If I'm not capable of explaining an illness, its cause, and the course of treatment in a way that makes cultural sense to my patient and/or their family, then there is a possibility of them refusing medical treatment. So let's look at some cases where my knowledge of a culture-bound illness will aid me in explaining medical treatment to the patient and their family. Susto is a culture-bound illness in Central South America thought to be caused by the soul leaving the body. Symptoms may include nervousness, insomnia, lethargy, listlessness, despondency, which is a state of low spirits, and muscle tics. Susto typically occurs after a traumatic event such as a relative's death or an accident of some kind. Cultural treatment is done by a spiritual leader in which they perform a ritual to cleanse the body of evil spirits or negative thoughts that are believed to be the reason the patient's soul left their body. Traditionally, Susto is healed by a spiritual leader, but in some extreme cases, spiritual cleansing may not be enough. The patient may then seek aid from a medical professional. Since Susto is a cultural-bound illness, the medical field views it by a different name and has its own way of diagnosing treatment. Medical professionals will most likely diagnose the patient with depression according to their symptoms. Symptoms of depression include, but are not limited to, a feeling of hopelessness, insomnia, irritability, anxiousness, and thoughts of suicide. Take note of the similarity of the symptoms of Susto and depression. Depression is treated by the use of antidepressant pills and/or participating in therapy. Once the illness has been medically identified and treatment proposed, the medical professional is now faced with how to explain treatment for depression as treatment for Susto. The use of antidepressants could be explained as a way of cleansing the body of evil spirits and harmonizing the body to entice the soul of the patient to return. Therapy, as another course of treatment, can be explained as a process of coaxing the soul of the patient to feel the need to return to the body. Another cultural-bound illness, known as Navajo ghost sickness, is attributed to Native Americans, primarily the Navajo. This illness is associated with the dead or dying. It is believed by the Navajo to be a result of the dead trying to take the living to the spiritual plane or communicate that they are not at peace. It is caused by disturbing the dead or malpractice funeral rituals. Symptoms include general weakness, loss of appetite, feeling of suffocation, recurring nightmares, and feelings of terror. When it comes to medically explaining Navajo ghost sickness, the medical field is uncertain whether this is an actual illness or psychotic disorder. Many point out its similarity to paranoia, but all are unified on psychological treatment for the sickness. Medical treatment may include the use of psychological drugs to bring cognitive chemicals back into balance, the use of a psychiatrist, or a combination of the two. There are a few issues with medical treatment and Navajo's beliefs. The Navajo believe that treating Navajo ghost sickness is done by having a religious figure perform funeral rituals over the patient to send the spirits of the dead back to the spiritual plane. Therapy and pills are nothing like a funeral ritual. Since the Navajo believe this illness is to be caused by spirits of the dead, treating the patient would not make sense to them. A medical professional would need to be able to explain how the treatment would affect the spirits of the dead, which would be no easy task without a background in medical anthropology. It's not every day that a medical professional will be treating a Navajo Native American or a cultural-bound Susto illness from South America. However, an education in the field of medical anthropology will prepare a medical professional to be better prepared to treat their patients in any case of culture-bound illnesses. I intend on practicing medicine in the U.S. until the age of 55. At that time, I will file for early retirement and join forces with other medical professionals to work pro bono in a developing nation. A medical anthropology education will allow me to communicate my diagnosis and treatments to the natives of the developing nation. That will make sense culturally to them. If you are interested in medically serving developing nations, I suggest you look into a nonprofit known as Partners in Health. A link to their website is in the description below. If you have any unanswered questions about medical anthropology, I suggest visiting the webpage of the Society of Medical Anthropology. A link is provided in the description below.